Let's start with the easy question then. Maybe we can...
That was pretty easy. Go ahead.
All right, Doctor, you're going to have to just answer the questions.
Okay. Sorry about that.
Yeah.
Getting into it.
You need to just answer the questions,
Okay.
Dr. Spiegel.
Do I have to answer that question, Your Honor?
You have to answer questions. Yes, sir.
And what is your occupation?
Good.
How many years have you been practicing as a psychiatrist?
I've been...
Please describe for the jury the nature of your clinical practice. And how many patients do you regularly see? What, if any, differences are there on how many patients you see on weekends as opposed to weekdays?
So when I'm on...
Dr. Spiegel, how frequently have you treated patients who abuse drugs and alcohol?
When I saw what?
What, if anything, have you seen in terms of emails, audios, videos?
Yes, so I've seen videos of Mr. Depp. I think the video was showing right of Mr. Depp destroying, slamming cupboards and...
In how many states have you been qualified as an expert? Are you board certified? What, if any, observations did you make about impulse control? And have you peer-reviewed literature in the field of psychiatry and behavioral sciences with specific emphasis on drug and alcohol abuse? But what, if anything, did you observe relating to erratic behavior based on the record evidence?
Yeah, I mean, I think... When I saw what?
And what, if any, risk factor is narcissism for intimate partner violence?
I think Mr. Depp was able to control much of his behavior, much of his thinking, even if it was aberrant or negative. He was able to control that. A lot of acting out, if you would. Multiple texts, multiple things that Dr. Cowan were doing in therapy. It was without relaying it exactly. I'm trying to be as accurate as I can. Was very common for me to read. But regardless, I think...
And what effects may it have? This is one of the drugs that Mr. Depp was taking.
Yes.
It was a prescribed drug?
Yes.
Okay.
So
what? Yeah.
So it does have that street value portion. It has significant street value, and
In the dosage he was taking.
again, okay, again.
To the jury, what that impact would have, in particular in connection with the dosages.
Objection. Record evidence.
What, if any, what, if any, traits would be requiring admiration? Would that fit into it? What, if any, record evidence do you have that correlates with Mr. Depp being narcissistic?
This court case was over.
There's objection, sir. Okay, what if any gaslighting is consistent with intimate partner violence and the risk factors? All right, now we've seen Mr. Depp during this trial doodling and eating candy. What, if any, evidence would that suggest that he has narcissistic traits?
Objection, Your Honor. No foundation.
I'll sustain the objection.
All right. And the next one you listed was fragile self-esteem. Do you recall that?
Yeah.
And what is the record evidence of Mr. Depp exhibiting that? Now, you were asked about the cluster B. Evidence was there that Barney Jacobs diagnosed Amber Heard with either borderline personality or histrionic personality disorder.
Objection, Your Honor.
That's fair cross. He asked the question. That's fair. We direct.
Beyond scope.
It's not overruled. Thank you. Is there examples where an intimate partner, violent perpetrator, why not?
No foundation.
He was explaining what the gold bar.
You've never conducted any empirical research on individuals who experience intimate partner violence, have you, sir? You haven't written any chapters of any books specifically about IPV.
Again, I think I've gone over that.
But and the name of the rule came from that. But the rule says it is unethical for psychiatrists to offer a professional opinion about an individual. That's right, sir. It's not just presidents, it's not public figures, it's individuals.
Funny, it was named after. According to your logic, if you don't put something in the title, it's not true. That's what you told me this morning, I believe, about my intimate partner violence. So what I would say to you then, sir, is that if you say this about an individual, again, any court would have to render expert witness testimony invalid. Any doctor that reviews charge would have to render it invalid. I can go on the list of docs that do not see or interview patients directly, and that's a violation. So basically, you are saying that unless you do a direct clinical evaluation, then all of the field of forensic psychiatry and all of managed care is doing an unethical violation because we are not seeing the presence. We deny patients medications all the time without seeing them. We deny patients treatments, unfortunately, without seeing them. And I'm on the receiving end of that. So the answer to your question, again, unless you were saying to me that all of this is unethical, which is what you were saying. This is how I'm interpreting what you were saying to me. That unless you do the evaluation directly yourself, therefore, it could not be considered ethical. And I'm telling you how that's applicable to not just expert law, but also managed care, and applicable to multiple brain cements. Hospital duration of hospitalization stay to get evaluated. So tell me where you want me to end this.
No, okay, why don't we talk about what you just testified to? Because I didn't ask you anything about that. I asked you whether, under this rubric, under this principle of medical ethics, have you acted unethically? Yes or no?
No, as an expert witness, I have not acted unethically. And if you want the jury to believe that expert witnesses are unethical, then I guess that's for them to decide.
Yes,
That's
that's
for them to
you said
decide.
no. Let's go to the next question. Right? Do you agree with that?
I believe I said that earlier, yes.
And it's I think, started with the notion that this rule applies broader than diagnoses. You've read professional opinions relative to narcissistic personality traits, haven't you, sir? Relative to Mr. Depp.
Again, I believe you just commented on what it takes to do a psychiatric evaluation to establish a diagnosis. I'm almost certain that's what you said. And maybe I'm wrong. Maybe you didn't say that, but I'm sure you did. And therefore, what I'm saying is neither IPV, nor substance usage, nor narcissistic personality traits are psychiatric diagnosis. And then, under the rubric of expert witness testimony, you are saying I acted unethically on the rubric of expert witness testimony. So if you, sir, would like to concede that expert witnesses are unethical, based on that, I'm not going to sit here and disagree with you and waste everyone's time. I think it's fairly obvious. But thank you. I'll go ahead. These were your words. I'm just saying back how they're interpreted.
Okay. Let's start with the easy question then. Maybe we can.
That was pretty easy. Go ahead.
All right, Doctor, you're going to have to just answer the questions.
Okay. Sorry about that. Getting into it.
You need to just answer the questions,
Okay.
Dr. Spiegel.
You are not rendering any diagnosis whatsoever of Mr. Depp today or ever.
No, I probably would say to you that certainly I would not say narcissistic personality, I would say traits. Certainly from what I have read, intimate partner violence is not a diagnosis, so the answer is no for that. Narcissistic personality traits is not a diagnosis, the answer is no. But if you want to tell me that substance use disorder is a psychiatric diagnosis, the answer is yes.
But that wasn't an issue, was it? Whether Mr. Depp used substances. I mean, you said you've gone through the record. That wasn't really an issue with this trial. He's said it from day one.
Oh, so you're saying he's already admitted to the diagnosis?
He's already admitted to the use of the substances.
Well, again, there's a difference between admitting to substance use and substance use disorder.
Let's go back to what you just said about narcissistic personality traits.
Yes.
Narcissistic personality disorder is a DSM-5 diagnosis, correct?
Correct.
Diagnostic personality, and you haven't testified that Mr. Depp has narcissistic personality disorder, have you?
I would certainly, if I didn't, I'm certainly thinking that, but at least I'm going to say his traits, which are characteristics of provisional diagnosis of. It's a provisional diagnosis of narcissistic personality. So, yeah, I mean, I do believe that.
Well, when you say provisional diagnosis, you know the DSM-5 requires, in order to find that diagnosis, 5 of the 9 factors. And you haven't done that analysis. You've never made that diagnosis. You've just identified certain factors.
That are criteria for the diagnosis.
Right. But you need 5 of 9 to get to the diagnosis. You've already told us that you didn't make a diagnosis. You're just identifying traits, correct?
I'm identifying traits that are consistent with the diagnosis, yes.
Right. And did you testify in deposition that the existence of traits, as opposed to the disorder, doesn't have a correlation with IPV?
If I said traits do not have a correlation with the, that's what I said. I don't remember saying that, but that wouldn't be correct. Saying narcissism has a correlation with the diagnosis. Yes, that part's true.
How far are we going to back this up? Because there's a diagnosis of narcissistic personality disorder, right? Yes. And that one is has some correlation with IPV, right?
Narcissism has correlation with IPV. Again, sir, you're not allowed to answer. You're splitting hairs. You're splitting hairs between the traits that are consistent with, which all I'm commenting on is behaviors and traits that are consistent with the diagnosis and Mr. Depp. Narcissism absolutely has risk factors associated with IPV.
Let's go back again, and maybe we can focus on the question I asked you, and we can get an answer.
And maybe we can focus on the question I ask you, and we can get an answer
that's addressed to that question. Narcissistic trait, in and of itself, is a risk factor for IPV.
But you are miscategorizing what I said. And I'm not sure, the thing I don't understand is, I'm not sure why we're arguing psychiatry, because I'm telling you what it is.
Dr. Spiegel, you just need to answer the questions.
Okay. Borderline personality disorder is a risk factor for IPV.
Are you referring to Mr. Depp, Ms. Heard? I'm not sure what you're talking about.
Do you understand that there was a medical examination done of Ms. Heard?
Yes, I did.
Do you understand that the testimony was ultimately that Ms. Heard suffers from 2 personality disorders?
Okay, so I'm just being specific. I just want to know if you're talking about Ms. Heard or Mr. Depp. So that's what I was asking.
Yes or no to my question?
Which was there's only one diagnosis of, Ms. Heard was diagnosed with that.
Yeah, let's move on to a new question. Okay. All right. You indicated, in your opinion today, that you thought, well, why don't we move a little. Are you a member of the American Medical Association?
No.
Okay, so you don't know what the ethical rule of the American Medical Association is relative to doing clinical diagnoses about individuals you've never talked to.
So you're saying you're going to do expert witness evaluations under that rubric, right?
I'm just asking you, do you know the AMA's rule?
So you were talking about expert witness testimony.
No, I'm talking about, do you know the rule?
I'm not a member of the AMA, so
Okay,
I
great. Okay, move on. You don't know the rule. You compared pirates to the to the depositions given.
And I apologize for what I said. Then I misspoke.
Yeah. So, but no, any of Mr. Depp's other portrayals in movies, did that affect your analysis of prostitute speed?
Only I've seen him interact on interviews, and that was it. When he wasn't in movies.
Right. But Willy Wonka doesn't matter to you? You see him in that movie, Charlie and Chocolate Factory? Did you look at that one when you were comparing prostitute speed?
Do I answer that question now?
prostitute speed. Is that, do I have to answer that question, Your Honor? Prostitute speed. Is that, do I have to answer that question, Your Honor?
You have to answer questions. Yes, sir.
No, you'll be happy to know I didn't see Willy Wonka. I didn't see 21 Jump Street when it happened. No, I did not.
All right. You made a very kind admission, I think, early on in your deposition, that you're not claiming to be a better actor than Mr. Depp. That's correct, isn't it?
100%.
All right. But with respect to acting, you know that actors actually rehearse for their parts and work on the language, diction, timing of their dialogue as part of that rehearsal? Okay. During your deposition, what were the circumstances under which you decided to call Mr. Depp an idiot? No, his overall functioning. But you made some testimony today as to some evaluations you made relative to his functioning. You would agree with me that it's probably a good idea to think about the questions that are asked you in a court proceeding before answering. Okay. Now, there is an element of that exam that requires drawing, correct?
Yes.
So, ultimately, you had no idea what state Mr. Depp was in at the time you took the exam that you're relying on. Let's talk a little bit about this word you kept using,
correlation.
You know the word, right?
Yes.
Yes.
As you said, not everyone who smokes gets lung cancer.
So there are significant numbers of people. You said it was over 50. So you'd say 40% of the people who have substance abuse disorder don't commit IPV. Either commit IPV or you didn't.
I mean, you either did or you didn't. Yes.
Right. So you took an issue with me because I was asking about substance abuse generally, and you wanted me to talk about the disorder. I asked you earlier about narcissistic personality disorder, right? You haven't made that diagnosis. You just talked about the traits, right?
Yes.
And if somebody had these narcissistic personality traits,
When I saw what?
sleeping agent, Seroquel, when used off-label,
When used off-label, it's used. I can be used sleeping agent, yes.
right? So, Mr.
It's used off-label for anxiety.
Right. If you gave lectures, you wouldn't use an earpiece, but you're not going to tell anybody how to act.
I'm sorry, what's the question?
I said if you gave lectures, you wouldn't use an earpiece, but you're not telling anybody how to act. Your testimony about the use of an earpiece, as maybe you were wrong. You're comfortable with the fact that you may have made a mistake there?
No, because I think in the basis of what I've read about it, I'm comfortable that I don't believe that actors are routinely given their entire script through earpiece. I find that hard to believe.
Yeah, but not one word of evidence that this ever happened here.
I guess what I said. I just said I find it hard to believe. I didn't say that. I said I find it hard to believe. That's all I said.
Yeah, but what you found hard to believe, sir, was that every line of the script was pumped to an earpiece. Where did you ever get the idea that occurred?
That's what I read, and they got court review. Court evidence. That's where I got it from.
You know whether Marlon Brando used an earpiece?
Is he dead?
Yeah.
So the answer is no. He does not use one now.
No, I used the past tense.
Oh, I'm sorry. Again, I know nothing. I will concede to you. I know nothing about acting. I will concede to you 100%. If that is the standard, and people have done that acting, then I apologize, and that was wrong on my part. If that's the standard, I'm wrong. I don't know.
Okay. Let's go with that. No further questions.
All right. What, if any, record evidence was there that Mr. Depp requires admiration?
Am I elaborate?
Yes, just a little different than what you said before.
Okay. So if
And then, in addition to that, Ms. Heard requested twice of the court for Mr. Depp to be submitted to an examination. Correct?
Yes.
And those were denied, correct?
Yes.
The second one that you discussed was sense of entitlement. Do you recall that testimony?
Yes.
All right. What record evidence is there that Mr. Depp exhibits behavior of needing a sense of entitlement?
Can I be heard?
Okay. What, if any, evidence did you find in any of Dr. Curry's testing that Amber Heard had either borderline personality disorder or histrionic personality disorder?
Objection compound. And leading.
What, if anything, did Dr. Banks' report, not saying what the ultimate conclusion was, what, if anything, did Dr. Banks say about what was reported to her by Ms. Heard and Mr. Depp and how they responded?
Professor who at Harvard, the leading institution in America for medical schools, who's an expert on intimate partner violence, she had a chance to meet them in relationship counseling.
Objection, Your Honor, non-responsive.
That's not non-responsive. I said, what, if anything, did you find? Stand. All right. Tell the jury about Amy Banks, the significance of Amy
So
Banks.
what Dr. Banks found was that she fully believed Ms. Heard's version of what was going on.
Objection, hearsay.
All right. What, if anything, did Mr. Depp do in response?
The significance of that is with
Objection, no foundation.
Sustain. Combining that with cocaine and alcohol?
Objection, no foundation.
A one? So, let's merge. Okay.
Really, 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 really need your love. I'm begging you to be kind. I'm begging